My friends, while we're living in fraught times, facing the new threat of the COVID-19 pandemic, the old threats have not gone away. As they have been for many years, non-communicable diseases are the world's leading cause of death. Many of these deaths are in people under 70 years of age, and most occur in low middle-income countries. COVID-19 makes preventing and managing NCDs especially important. People living with NCDs like diabetes, heart disease, stroke, and cancer are particularly vulnerable to becoming severely ill with the virus. More than 2/3 of the 60 million deaths around the world per year are due to NCDs. Nearly half of those are from cardiovascular diseases. This is an unnecessary tragedy. NCDs can be prevented by adopting a healthy diet, being physically active, and eliminating tobacco use and abuse of alcohol. Industrially produced trans fat causes heart disease and death, and yet it's still used in many countries in fried and baked foods and in spreads. These trans fats can be replaced with healthier fats and oils without changing the taste or cost of food. Elimination of industrially produced trans fat from food is a priority for WHO. Why? For 3 reasons. First, it will save lives. Second, it is feasible. Yes, some industries will need to adapt, but other industries will gain a new market. There is almost no cost for governments and consumers. In fact, there is a huge windfall in terms of lower health care costs. Third, it will reduce the burden on healthcare facilities at a time when COVID-19 is already taking a huge toll. For WHO, eliminating trans fat has been a focus of work for several years now. In 2018, we launched the Replace Action Framework, followed the next year with detailed operational guidance and the first progress report to inspire and help governments eliminate trans fat from their nation's food supply. Just as WHO has led the global eradication of smallpox and polio, we're leading a global movement to rid the world of trans fat by 2023. Best practice policies are now in effect for almost 600 million people around the world. In addition to launching the second progress report today, I'm delighted to announce WHO's plan to certify and recognize countries and their leaders for eliminating industrially produced trans fat from their food supplies. I would now like to hand the virtual podium over to my friend, Dr. Tom Frieden, President and CEO of Resolve to Save Lives, an initiative of Vital Strategies, who has partnered with us on this global effort. Tom, thank you so much for your leadership. And
thank you so much, Dr. Tedros, for your leadership and for that really big news about certification. Artificial trans fat is a toxic compound. It kills hundreds of thousands of people each year, and it causes a large number of unnecessary hospitalizations. This does not have to be. 2 years ago, the World Health Organization, for the first time ever, called for complete elimination of a risk factor for a non-communicable disease, with the elimination of artificial trans fat from the global food supply. Although there's been good progress in these past 2 years, too many lives continue to be lost to trans fat unnecessarily. And if the world doesn't accelerate progress, it won't meet that deadline. Eliminating artificial trans fat from the food supply is economically, politically, and technically feasible. It can save lives at virtually no cost to governments or to consumers. With the Replace package, WHO provides countries with a clear and effective way forward to remove this toxin from food supplies through best practice policies. In just 2 years, there's been really encouraging progress. The number of people protected by trans fat regulations went from approximately 2.3 billion in 2018 to more than 3.1 billion by the end of 2021. This momentum can be attributed in significant part to effective regional initiatives. And Dr. Tedros, I remember when we launched this, you emphasized the importance of working regionally, and you were quite right about that. Last year, the European Union passed best practice regulations, and all countries in the PAHO region unanimously passed an action plan to eliminate artificial trans fat from the Americas. Together, these two regional initiatives have the potential to protect another 1 billion people in more than 50 countries not already protected from trans fat. These regional initiatives build on the model established by the Eurasian Economic Union and the Gulf Cooperation Council, the first regional bodies that passed trans fat limits. To achieve WHO's target of global elimination by 2023, regional action will be critical, and we look forward to seeing even more progress in Western Pacific, in Africa, and elsewhere. This is particularly important in places where there still is an absence of these protections. The second annual progress report launched today shows that there's been really good progress. There are important case studies and effective strategies to accelerate progress. WHO is committed to release this report each year and support countries in implementing best practice policies and holding countries to account. We call on every country to step up and champion this initiative at home and with your neighboring countries. By next year's report, more than half of the time will have passed to the deadline, and yet the world is not on track to be halfway there. Every country that hasn't yet protected its people from trans fat needs to act now. Doing so will save lives and save money. Now, some may think that we need to slow action because of the terrible COVID-19 pandemic that so many of us are now spending almost all of our time on. But in truth, prevention is more important than ever. Eliminating artificial trans fat is a way to save lives and prevent heart attacks, at the same time freeing up healthcare system time. Resolve to Save Lives has partnered with WHO on this effort and will support WHO and countries to implement the proven strategies of the Replace Action Package. Now, I'm particularly excited by Dr. Tedros's announcement on a certification process. Not only is artificial trans fat elimination the first elimination program to be launched by WHO, but now it has, in parallel to other leading global programs like global smallpox eradication, a certification process that will serve as both accountability and recognition to the countries that have done a great job protecting their people and saving lives. Together, we can achieve a world that's trans fat free by 2023. And I now turn it over to Dr. Chizuru Yoshida to provide an overview and highlights of the report. Thank you.
So we'll now give the floor to Dr. Chizuru Nishida for the presentation of the main results of the reports. We're already receiving some comments and question and answers. You have a Q&A box here, and question we're receiving is about whether WHO will have separate guidelines for the ruminant trans fat that is naturally occurring in dairy and meat. And another question is about the strategies to engage with policymakers to advocate for forming regulation to eliminate trans fat in a pandemic. So what are the incentives the industry has for eliminating industrially produced trans fat, since industry is engaged in developing regulations on this? We should have the presentation now. Again, other questions are, poor countries and developing countries will be the biggest challenge. how the WHO will support these countries to address these issues. And there is a question also about industrial trans fat guidelines on the use of fried foods and oil used for frying. Some of these issues are addressed by the replace package. So perhaps I suggest that Dr. Nishida starts without slides, yeah.
Thank you, Francesco, Dr. Branca. We're waiting for the presentation to come on, but I will start as both the DG and the Dr. Tom Frieden mentioned, the industrially produced trans fat has no known health the benefits. So we have WHO has called the global elimination for industrially produced trans fat by 2023. And we have been monitoring the country progress since then. In order to monitor the trans fat elimination policies which are being implemented by countries, we have developed country scorecard which are very clearly described in the report, which you should have access by now on our WHO website. And in order to monitor the best practice, in order to encourage the countries to achieve this 2023 goal, we encourage countries to develop, implement best practice trans fat policies, which WHO recommends. There are two options. One is to limit the industrially produced trans fat to 2 grams per 100 grams of total fat in all foods. And second option is to ban the partially hydrogenated oils. With these country scores, we develop the maps, the global maps, which are, which you will be able to see on the in the map, in the report, also in the WHO website and on the database called GINA. For this year, during this past year, there have been a great progress, particularly in two countries, Brazil and Turkey, from whom that we will hear. These are the two countries which have passed their best practice policies during the past year. There have been the various other countries, the policies which have became in effect. And also, I have pulled out this graphs, which is also included in the report. This graph shows the increasing trend of the number of countries introducing the best practice trans fat policies. Today in 2020, the best practice TFA policy has come into effect in 14 countries, covering approximately 600 million people, as DG mentioned. But in the next 2 years, additional 26 countries have passed the best practice TFA policy, which will come into effect, covering over 800 million people. There have been some trends which we could highlight. The first one is that there is increasing, the number of regions have developed the regional or sub-regional actions. And this is some of the examples of the trends that which we have been seeing. Second trend we have been seeing are the more countries are shifting from less restricted policies which they have had in an earlier year to improve them and transfer them into the best practice policies. And these are some examples. We will be able to see that the sum of the constraints that we are still facing, these best practice policies, unfortunately, have not yet been implemented or developed and implemented, particularly in low income and the lower middle income countries. So therefore, that we very much encourage the more countries to work on developing the best practice policies. We would now like to also share very quickly the annex of the data which we had included. This data was made possible, this analysis was made possible with the generous contribution of the data, which unpublished data, which was shared by the IHME team, headed by the Dr. Ashkan. And this ranks, the countries are ranked in this table in the descending order according to this TFA attributable coronary heart disease death burden. Among these are some, what is shown here in the slide are the just top five examples. However, there are 15 top countries which which consist of the 2/3 of the death burden. Among these 15 countries, only 4 countries have implemented best practice policies. 11 countries have not yet done so. Therefore, we very much recommend countries to develop and implement best practice policies and strengthen national regulatory capacities in order to do so, in order to also monitor monitor the progress and the content of trans fat in the food, is therefore to also strengthen laboratory capacities, and also to advocate for, where possible, the regional or sub-regional regulations. In order to support this effort by countries, WHO will continue to provide a technical support for strengthening regulatory capacities, including laboratory capacities, and the recognized country achievement, and share the country experiences and good practices, as we have been doing through the publishing of this annual report, and we will continue to undertake the global advocacy. We would also expect industries to, particularly the food and beverage industry groups, to implement the commitment they have made in May 2019 to eliminate industrially produced TFA from their products by 2023. We also expect the major suppliers of fats and oils step up to remove partially hydrogenated oils that are sold to food manufacturers globally. I would like to end this presentation with this acknowledgement. This was not possible without the support and the contribution of, first, member states and the national focal points, and various colleagues from the country office of WHO, as well as from the regional offices. And in addition to the headquarter colleagues, I have listed here also the colleagues who have made this launching event possible. And also would like to recognize the team at the Resolve to Save Lives, headed by Tom, and as well as the IHME colleagues, as I mentioned, Dr. Ashkan and his team, for share with us this unpublished data that they have compiled. I would like to, however, highlight particularly the 2 colleagues from this WHO and the Resolve team. That is the Dr. Ryan Yamamoto, who is here, and also from the Resolve, the Dr. Lindsay Steele, these 2 colleagues have really made the production of this year's report possible. Thank you.
Thank you very much, Dr. Nishida. This is a history of success. We're receiving many questions and many comments from the over 300 participants that have connected with us today, but it's really to celebrate successes. And we'll address the questions in the rest of the meeting, but really to celebrate success, we would like to call in 2 of the countries that have made some considerable progress in this space. First of all, Turkey, and Turkey will be represented by Dr. Bekir Keskinkilic, who is a specialist in family medicine. He worked as the Deputy Director General of the Directorate of Treatment Services and also of primary healthcare in the Ministry of Health of Turkey. He is currently the Deputy General Director of the Directorate of Public Health, and he's been a member of the WHO Executive Board between 2016 to 2019. So I hope, Dr. Bekir, you are connected. Can you hear us and can you give your experience?
Thank you very much, Chair. I hope my voice can reach you because I'm having some technical problems to send my video.
Loud and clear, thank you. Please go ahead.
Please accept my picture. It's a little bit better looking than me, indeed. And I'll try to be quick and concise. Without any doubt, NCDs are the most important health problem of our era, even if the latest pandemic caused some changes in people's perception. In my country, 2 out of 3 persons have problems related to weight control. 1 out of 3 are overweight and 1 out of 3 are obese. Turkey is not an exception to all the other countries. The health impact of the major NCDs, namely diabetes, cardiovascular diseases, cancer, and chronic respiratory diseases, is alarming. And taken together, these 4 conditions account for the majority of mortality and morbidity. NCDs are responsible for 89% of all deaths in my country, of which 36.6% are due to cardiovascular diseases. The probability of premature death, I mean the death before the age of 70 years, from one of the 4 major NCDs for a person living in Turkey was around 1 in 6, 16% in 2019. The economic burden analysis found that government expenditure on healthcare for NCDs is just the tip of the iceberg. The hidden additional costs from lost productivity are higher than the healthcare costs directly. Altogether, the economic cost of NCDs to the Turkish economy in 2016 estimated as nearly 70 billion Turkish liras, which is equivalent to 3.6% of country's annual gross domestic product. We all know that industrially produced trans fats are an unnecessary and potentially harmful chemical, often found in baked goods and deep fried foods, and in places without policies to restrict them, are associated with increased risk of heart diseases. Elimination of industrially produced trans fats from the global food supply is thus considered a life-saving public health intervention, and we completely believe in. Elimination of trans fats was one of our priority aims since 2014, declared as a priority in our national program for health and nutrition. It was not an easy process indeed. We discussed the issue with all stakeholders in different platforms repeatedly. We performed some laboratory studies to assess and monitor of trans fat content in the food supply with Ministry of Agriculture and with the WHO support, which gave us very important evidence for mandatory approach to the elimination of industrially produced trans fats from the food supply. And in the end, we managed to convince all stakeholders, including food industry. We recently announced in May, I think to be exact, 14th of May, announced regulations limiting the amount of industrially produced trans fats allowed in foods. As per WHO recommendations, the regulation requires that foods intended for the final consumer and for supply to retail contain no more than 2 grams of trans fats per 100 grams of fat. These measures are an important step towards the elimination of trans fats from the food supply, which will save thousands of lives per year. As we implement this best practice trans fats policy in Turkey, we have joined member states of the European Union and the Eurasian Economic Union, as well as other countries in the region, in taking measures towards being trans fat free. These moves the WHO European region closer to being the first WHO region in the world to become trans fat free, I hope. I'd like to thank WHO at 3 levels, Resolve to Save Life Initiative and WHO UN Task Force for their technical support in this process, of developing and implementing this regulation. We worked very closely with WHO country office and regional office for Europe throughout the process of developing and adopting the best practice trans fatty acid policy in Turkey in line with WHO Replace Action Package. We will continue to closely collaborate with WHO and other partners for the implementation of the regulation, which will be in effect starting from 2021. We hope to prevent premature deaths. All the country will able to show great political commitment like as Turkey, which will reduce exposure to artificial trans fats and increase the availability of healthier alternatives to reduce the number of deaths from cardiovascular diseases. I thank Dr. Tedros and Dr. Frieden for their awesome commitment for prevention, control, and management of NCDs, and would like to congratulate all WHO colleagues for launching the WHO report on global trans fat elimination 2020. Thank you very much for your kind patience.
Thank you very much, Dr. Bekir, and thank you for sharing the secret of your success, a clear, strong advocacy on why trans fat should be reduced and the enormous savings in terms of health and burden and cost to the health service, the discussion with stakeholders, basing on the guidance received by WHO and working on a strong, clear regulations to contribute to make the European region the first region to be trans fat free on the way to the global elimination. And with this, I'd like to invite our next guest speaker, Dr. Eduardo Nilsson from Brazil. Dr. Nilsson is a biologist and is an expert in the formulation, monitoring, and evaluation of nutrition policies with over 20 years of experience at the Ministry of Health of Brazil. He's currently the Deputy Coordinator of the Food and Nutrition Division in the Ministry of Health in Brazil. Eduardo, please, you have the floor.
Thank you very much, Chair, and greetings to our friends in the audience and all the colleagues. And firstly, I'd like to congratulate WHO, PAHO, our regional office, and Result for releasing this report, and also for all the support given to all the countries, especially in the region of the Americas. I'm not sure if my presentation will be loaded, so I'll be talking. Meanwhile, that trans fats reduction in Brazil has been a priority policy in Brazil over the last decade or more. And I'd like to the second slide, please. Thank you. And this is the behavior of deaths by NCDs and cardiovascular diseases in Brazil. We're struggling to reduce the impact of these deaths, but meanwhile we have been quite successfully and gradually and continuously reducing the deaths that are attributable by diets high in trans fats. And as Turkey, we have a large burden of NCDs in Brazil. Over 70% of deaths in Brazil are related to NCDs, and most of these deaths, around 20%, are from cardiovascular disease. So it's very important for us to continue with acting on all the dietary factors, especially sodium, sugar, and trans fat saturated fats reduction, and also on the increase in healthy diets related to fruits, vegetables, fibers, and other markers. Next, please. So considering the sources of trans fats in our diets, we have an increase in the participation of industrialized foods, so-called ultra-processed foods in the NOVA classification. But we've been successful because it's very important for us to address these sources. And part of this is through food reformulation. And I will try to detail a little bit about this on the next slides. Next, please. But what we haven't been experiencing in Brazil is that the traditional diet has been replaced by processed and ultra-processed foods, so it's a double struggle to promote healthy diets and also to reduce the burden related to these foods. And we have trying to align ourselves with all of the international landmarks that started with the global strategy by WHO. And one big landmark was the Declaration of Rio de Janeiro, which the Trans Fats Free America, that was led by PAHO, and set limited for the region in terms of oils and other foods for trans fat content, and also the mandatory labeling of trans fats in foods, and following many of the other actions that have been reinforcing the importance of replacing trans fatty acids by polyunsaturated fats and how important and cost-effective they are. And finally, the replace strategy, which has systematically and comprehensively addressed this approach and has provided large support to many countries. Next, please. So in terms of the national landmarks, they are very much aligned, as I said. Next slide, please. They're very much aligned with the international landmarks. And firstly, the mandatory declaration of the previous one, please. The mandatory declaration of trans fatty acids in food labels, which is not only for Brazil, but for all of the countries in the Mercosur region. Thank you. The Trans Fats Free Americas in 2008. And following, we have the regulation of health claims. It was very important to have the trans fats free health claims that helped industries and stimulated industries to reformulate foods and to eliminate industrially trans fatty acids from their products, following the dietary guidelines for the Brazilian population, which rescues the traditional diets in Brazil and helps us in terms of the policies directed to healthy diets. And we have an increasing demand from 2016 to 18 for the elimination of trans fatty acids regionally and in the country. And finally, in 2019, we have a bill on the elimination of trans fatty acids and partially hydrogenated oils. Next, please. So our first step was, I think, a major step after the mandatory declaration of trans fatty acids was the Trans Fats Free America initiative, and the major food companies in Brazil have committed to that, and that has actually opened us to addressing other nutrients in the future as sugars and fats and sodium. So and we have this the alignment complying in 2 years for having a 5% limit in oils and 2% limit for oils and 5% limit for trans fatty acids in other foods. Next, please. And as a result of this, we had the monitoring in 2010, which showed that we had a significant impact on the internal and regional market, as Brazil also exports lots of these foods, and we have a reduction that was estimated in 230 tons of trans fatty acids a year that were not used anymore in foods, and we have major changes in most of the food categories and still remaining challenges in a few of them that have advanced even though in the future. Next, please. And now another survey that we had in terms of the impact of the health claims, and we see that many of the food categories have also reached a high percentage of trans fats free products in all of the markets. So it also stimulates the industries through labeling, and that walks hand to hand with advocacy as well, because civil society and academia have helped a lot in terms of spreading the message about the dangers involved in the consumption of trans fatty acids in the diet. So that's has stimulated even more the industries, and also stimulated healthier food choices by consumers in the meantime. Next, please. And our food guidelines, as I said, have a major message that's that the natural, unprocessed, and minimally processed foods should be the basis of the diet. And so we're trying to reverse a trend that is the replacement of traditional diets by industrialized foods, especially ultra-processed foods. So we're trying to fight against that, and we know that all the countries have their staple diets which are very healthy and free of trans fats mostly. So that's where we should reach for in terms of our health and nutrition education. Next, please. And I think one of the major turning points after that was in 2015, when there was a large building of international evidence about trans fatty acids having no nutritional benefit, of a strong association with cardiovascular outcomes, and the US FDA recognizing trans fatty acids as not generally recommended as safe anymore. So that built an international and regional case that was very strong. And at the national level, we have an increasing demand for the elimination of trans fats from civil society, medical associations, and also by the Congress. So that has led our regulatory agency called Anvisa to start the process. Next, please. And I will finalize speaking about a final regulatory process that is very much aligned with the best practices that are advocated by, resolved by WHO and PAHO, which started with technical meetings with experts and all stakeholders, including industries, food industries. I'm sorry, I think there's some French sound bleeding here, but the technical meetings with stakeholders, which include food industry and actual the food industries that work with those ingredients that will replace trans fats in foods, gathering international experience and scientific evidence. And finally, a major report on the regulatory impact of these measures, which took into account 3 regulatory proposals. One would be the continuing, but reinforcing for all the market, the 2% and 5% limits of trans fatty acids, but to more bold or robust alternatives as well, as having an overall 2% content limit of trans fatty acids in all foods, and banning PHOs, partially hydrogenated oils, from all the food chains, taking into account a plethora of criteria that are listed at the right, the foods included, the types of TFA, the magnitude, and also that includes health, economic, and regulatory aspects that are important for us to have all of the stakeholders aligned and supporting this. And it's very important that it was a consensus among civil society, government, and industries on the importance of moving forward in Brazil. And finally, a public consultation that approved the final resolution on the banning of trans fatty acids and PHOs in Brazil. And next, my final slide, which is we decided to have the 2 strategies that will have impact on most of the dietary sources of trans fatty acids in the country. So we do have the industrial foods, which are processed foods that are addressed by the limit of 2% trans fatty acids in content of food. And we have an 18 months deadline for complying to that by industries. And in the second phase, we are banning the use of trans fatty acids in all the food chain in the country. So that will address also other sectors like confectionery, bakery, small businesses. So we can have a more complete impact in terms of actually eliminating. And happy coincidence is that the deadline for this is 2023, which is the same as we have at the global level. And finally, I think I'd like to reinforce that it's very important for us to continue action, not only in Brazil, but in all the region, in preventing premature, preventable deaths. And the 2 main elements of these are eliminating, reducing risk factors as trans fatty acids, and healthier diets and healthier behaviors as physical activity, and eliminating the other risk factors that are very important for us to achieve all of the global and regional targets that we have. Thank you very much.
Thank you very much, Eduardo. And again, congratulations. It's been, of course, a roadmap with the progressive reduction from voluntary to use of labeling to then the more stringent mandatory following the good practices. I have the request to come in from 4 speakers for the moment. Dr. Faisal bin Zunaid. So I wonder whether we can unmute him to take the floor. I also would like, while Dr. bin Zunaid takes the floor, to start answering some of the questions that are coming in the chat. When one question was about industrial trans fat versus natural trans fat, can we distinguish them? It's actually not difficult, not possible, not easy to distinguish them. So our policies are targeting industrial trans fat because they are the main component of the consumption of the trans fats. And then is there a possibility to help countries with replacements? That is indeed a major challenge. replacement. We would not like to increase the saturated fat content of the diet while we replace the industrial trans fat. The replace document has a number of feasible actions, both for the liquid oils and for the semi-solid and solid products. Can we have Dr. Faisal bin Sunaid, the Director of the Healthy Food Department of the Saudi Food and Drug Authority?
Yes, hello there. Good morning, good afternoon, good evening. Thank you so much for hosting us over here at the WHO organization over here. And then it comes to the last or the second progress report on trans fatty acids. As you're aware of, the Saudi FDA, or let's say Kingdom of Saudi Arabia, has actually taken a lot of actions when it comes to eliminate the trans fat in food industry. Like as we say, we started we began our journey since 2015 by showing that or mandating the labeling requirement of trans fatty acids. Then we moved ahead to the limit or setting up an upper limit for trans fatty acids in all food products. And at the end, which is inshallah, let's say the best practice that we have for the meantime, which is eliminating trans fatty acids. Actually, the elimination of elimination of partially hydrogenated oil. The elimination of partially hydrogenated oil took an effect on January 2020, and I'm really glad to actually announce that we've conducted a monitoring and evaluation on the food products that we have and receive here in Saudi Arabia, and we found that almost 80% of the food products that we have in Saudi Arabia are actually free of partially hydrogenated oils, and we thank God. Then we thank everyone who contributed in this achievement. And the 20% or the rest of the food products that we have as 20% being not complying to the labeling requirements and the elimination of partially hydrogenated oil. We still have a lot to come, inshallah, in the future when it comes to monitoring and evaluation until we, inshallah, achieve the 100% compliance from all the food industry. Thank you so much for letting us, and thank you so much for hosting us. And I would like to extend my sincere appreciation to the WHO office here in the region, EMRO office over here, and Dr. Ayoub Al-Jawada. Thank you so much.
Thank you very much, Dr. bin Sunaid, and again, congratulations also to Saudi Arabia for these important developments. There were a few questions in the chat about how did countries achieve this progress, and particularly what was the role of civil society. And one of the people who've asked for the floor perhaps can also help us answer this question, and that is Dr. Rosenkrantz from the Global Health Advocacy Incubator, another important partner in this undertaking. Dr. Rosenkrantz?
Hi, thank you very much. I work with the Global Health Advocacy Incubator, an initiative of the Campaign for Tobacco-Free Kids that proudly supports civil society organizations from all over the world, advocating for trans fat elimination as part of the Resolve to Save Lives initiative. To support trans fat elimination, we draw on years of experience supporting advocates on a variety of public health campaigns. And first, I wanted to thank Dr. Tedros and Dr. Frieden for your extraordinary leadership and commitment to trans fat elimination. And also take a moment to appreciate the rest of the WHO team, as well as health advocates around the world for the important role they play at country level in advancing policy changes that are needed to eliminate industrially produced TFA from the food supply. Civil society can and should be engaged in shaping nutrition policy. Our work suggests 3 key contributions from civil society. Number one, by raising awareness of the negative health impact of trans fat consumption and levels of exposure to industrially produced trans fat, civil society can elevate trans fat as a public health priority and generate public and policymaker support for the elimination of industrially produced trans fat. Second, civil society can build consensus around evidence-based policy solutions, counter opposition, and solidify political will for change. Where evidence is lacking, civil society can play a role in filling research gaps. And then third, in many countries, civil society have the opportunity to assist the government throughout the policy process, from drafting and reviewing policies to monitoring their implementation. We at the Global Health Advocacy Incubator support advocacy that is evidence and human rights based, free of conflicts of interest and led by local actors that are always best positioned to assess the community's context and needs. And so we're very excited to continue doing this important work in collaboration with WHO and the Resolve to Save Lives initiative. Thank you.
Thank you, Dr. Rosenkrantz, for giving us this, this experience. I would like to call in another actor which has been called in by our participants, and that is industry. And some of the participants have actually indicated that industry has not been supportive in the countries towards the establishment of legislation, but we do have Julian Lafleur, who is the representative of the International Food and Beverage Alliance, and maybe he can address the issue of the role of industry. Julian, over to you, please.
Thank you very much, Francesco. First of all, congratulations to WHO, Resolve to Save Lives, and everyone involved in the important launch of this, this milestone. We express a lot of gratitude toward the leadership of Dr. Tedros, the whole of WHO and Resolve for the collaborative spirit with which they've encouraged the industry to play a part in this effort. I'd like today to reiterate our support to WHO's Packet Replace initiative. Our companies are currently implementing the commitments that our CEOs have made to the WHO last year to meet the WHO industrially produced trans fat standard across their product ranges globally by 2023. We are on track to meet this target, and we look forward to updating the WHO leadership and Resolve to Save Lives on this endeavor. As part of our commitment, I wanted to mention today that we're currently developing a technical knowledge repository to support SMEs in replacing industrially produced trans fat, with a particular focus on low and middle income countries. We look forward to continuing to support the WHO in the achievement of this important 2023 target. Thank you.
Thank you very much. And yeah, I hope that this means also more support to the implementation of country regulation, since there's a common understanding that this is the way forward.
Yes, Francesco, in fact, if you want me to react to this point, we're on track to reaching the target that's mandated toward in most of the legislation in the markets that are the most developed, not just at market level, but from a legislative standpoint. So naturally, we support legislative efforts that will overall naturally achieve the public health objectives that they're trying to reach, but most of all will level the playing field for the rest of the industry, which I believe from an industry point of view is the biggest challenge. Thank you.
Thank you for this and for your effort in this way. I have now
Francesco.
Mary Grace Rosales, who is the project lead working with the WHO country office to support the Philippine government. Ms. Rosales?
Hello. Hello, hi everyone. Hello. Hello.
Please go ahead, Ms. Rosales.
Yes, thank you. We in the Philippines thank the World Health Organization in sharing your joy in advancing the implementation of the Replace Action Package. And we are very happy to share that we are slowly building momentum towards the elimination of trans fat in the Philippines through the strong leadership of the Philippine Department of Health, the hard work of our legislators, and also the technical support of the World Health Organization country office in the Philippines. And proposed legislation to eliminate industrially produced trans fat is currently pending in the Congressional Committee on Health, and also a national policy on the elimination of industrially produced trans fat in prepackaged and processed food is also underway. And we trust that this is only the beginning. And we know that with the support of the World Health Organization through its country office and also its regional office here in the Philippines and in the region, we can slowly build towards a trans fat-free Philippines.
Thank you. We have a question about the powder 3-in-1 coffee and milk tea drinks. So I wonder whether you want to comment on the use of this popular product in the Philippines.
Yes, thank you. Thank you very much for that question. That is true. 3-in-1 coffee in the Philippines, which of course contains non-dairy creamer, which is a known source or a common source of industrially produced trans fat, is one of the commonly consumed food here in the Philippines. And we also know for a fact that non-dairy creamers are used in milk tea drinks, which is consumed very highly in the Philippines. And so we hope that with these policies, with proposed legislation already filed in Congress, and also a national policy led by the Department of Health of the Philippines, we can be able to reduce trans fat consumption and eliminate the source of industrially produced trans fat through either a ban of partially hydrogenated oils or a limit on the TFA content of food in the Philippines.
Thank you. And we're receiving many messages from countries that are part of the low and middle income category, asking, what about us? I mean, why are we going to get a special support from WHO? We receive messages from Nigeria, messages from Morocco, calling for existing experiences, but more help. That's actually what WHO is going to do. But before giving the floor to our final speaker, which is giving us the conclusion, our Assistant Director General, I'd like to respond to one of the questions around the certification schemes. What are the clarification? WHO is working on it, is looking at its existing schemes of certification, for example, the polio-free or the TB-free, and trying to establish criteria to establish also expert groups who would help us receive demands from countries to be certified as trans fat free. We hope that that's going to be an important incentive for this to happen. Also, the support to low and middle income countries might happen through regional bodies. And again, you have heard the experience of the European Union, you have heard the experience of the America Trans Fat Free, but also there's a strong interest in the African continent to make this happen. But now, please let me introduce Dr. Naoko Yamamoto, Assistant Director General of the Division of Universal Health Coverage, Healthier Population in WHO.
Thank you, Francesco. Thank you very much. So now the launching event is coming in. So I would like to express my deep appreciation to especially Dr. Tom Frieden and the representatives of the government of Turkey and Brazil, and Dr. Teros, as well as our WHO colleagues. And I also would like to thank all speakers who had contributed to our discussion. As Dr. Tedros highlighted, WHO is committed to eliminate industrially produced trans fat from the global food supply by 2023. So good progress has been made, as we shared in the report, yet important disparity persists in policy coverage by region and countries' income levels. Best practice trans fat policies have been adopted so far by 7 upper middle income countries and 33 high income countries. No lower income countries or lower middle income countries have adopted best practice trans fat policy to date. Taking such action would be a great way to make health savings. WHO, together with country offices, regional offices, and headquarters, as Francesco has said, that is committed to providing technical support to countries, sharing country success story and good practices to ensure that people in all countries benefit equally from protection from trans fat. So WHO's commitment remains during the global COVID pandemic, when prevention and management of NCDs is critically important than ever before. Eliminating industrially produced trans fat from food is feasible, cost-effective, and will save lives. Please join us our journey to count down to 2023 to eliminate trans fat. I know many people in the world have already participated in this launching event, So really encouraging. So let's work together. So thank you very much again for joining this event. Thank you.
Thank you very much, and thank you for attending this event. We'll work together for the future, and I'm closing the event now. Thank you.